welcome to India TV. This is Palak Yadav. Today we are celebrating No Tobacco Day. Now, I know for most of you it might be just another day wherein you don't get a holiday from your office, but let me tell you this. Every single year, 1.35 million people die because of tobacco consumption. And that, my friend, is why we need World No Tobacco Day. Today we have a very special guest with us, Dr. Sarvinder Singh. He is a renowned pulmonologist from Yatharth Hospital. Hello, sir. How are you?
Good afternoon to you and to all the viewers of India TV.
Great, sir. It's really great to have you today. So, sir, I wanted to ask you, since, even from a rickshaw puller chewing gutka to a highly educated corporate employee smoking vape, tobacco has become a part of our lifestyle. Absolutely. So, why is it that, we feel the need for tobacco whenever we feel stressed? What is it that, we need tobacco whenever we are overworked or stressed?
Yeah, actually, there are so many reasons for using tobacco. The tobacco, smoking or chewing or whatever it is either the social reasons, like the area which you come from, people are smokers or they chew tobacco. These are people who use it, or it is because of, as you said, the pressures. The pressure can be a peer pressures which are put by the possibly by the media or the advertisement when they're shown in the movies, machoism associated with tobacco. All these may be reasons, but I think the peer pressure and the social reason are the most common reason why people start smoking, and when they start smoking, get hooked to it, then there's no way out of it.
Right. So it must have some neurological effects, right, on us that makes us, compulsively want tobacco regularly.
Yeah, certainly. That is what is I said. Once you start using
Yes.
it, you get hooked to it. The nicotine level, when it comes down, there's a craving for using it. You start looking for it, and that's when we talk of addiction to tobacco.
Right.
That is how it starts.
Right. So, sir, as you know, these days there is a trend of vaping, the e-cigarettes. So, sir, what
Yeah.
according to you is worse, a cigarette or a vape?
Actually, vaping came into vogue as one of the replacement or a therapy for tobacco, quitting the tobacco. It was promoted initially as to simulate a smoking and to not have a bad effects of smoking.
Yeah, right.
Though it is still being used as one of the way of quitting tobacco smoking, but it has been shown to have very bad side effects. May not be as bad as actual smoking, but getting addicted to vaping and the side effects of nicotine use in vaping has been seen as they are seen in tobacco use.
Right. Because these days it has become a trend. Even kids who are not even 18, they are vaping. So,
Yeah.
it's something cool these days. Something absolutely that, people find we should do, we should look cool like that. So, sir, is it safe to smoke around other people? Like, how badly does a non-smoking person get affected by a smoker?
Yeah, what you said is basically a second-hand smoker or the passive smokers.
Yeah.
As you mentioned, there are about 7 million deaths associated with smoking per se, as a direct smoking related, and 1.2 million are because of the passive smoking. Those are not smokers, around to smokers. Their side effects of passive smoking are as bad as smokers are related. So, I mean, as we promote in No Tobacco Day, is not only not smoking, but to how to avoid this passive smoking and to have less side effects of passive smoking too.
Right. So, as when a person smokes, there are certain fumes coming out. There is tar that gets collected, right? So what is the process? Like, how do the tar and fumes get trapped in our lungs?
Yeah, tar. I mean, tar is when you take a smoking, when you smoke in a cigarette, along with nicotine, the tar also goes into the lungs, and it gets accumulated in the airways, and that is how it leads to the inflammation of the airways and leads to the COPD and other side effects. So once the tar is accumulated, because the repeated smoking, it leads to difficulty in passage of oxygen from air to the blood, and all the side effects of the smoking are seen with that. In fact, when you quit smoking, slowly the tar may come out of it and you may have less effects. But when you restart smoking, the tar gets accumulated again.
Right. So we all know that, we start with one puff, then two puff, then, it turns into one cigarette a day, 5 cigarettes a day, and before we know it, we get addicted to it. So can you suggest an effective method to, get rid of this addiction?
Yeah, I mean, one of the most difficult thing to is get rid of addiction to tobacco. However, the most important thing is the willingness on a part on part of the individual to quit
Absolutely.
smoking till it comes from within. Whatever way we do, it may not help the patients. So the basically as for doctors are concerned, we have something called 5 A's to assist in the smoking, quit smoking. The 5 A's are there. Like a doctor asks the patient about his smoking habits, whether he's a smoker or not a smoker. Then after that, he advises the patient to quit smoking and does not straightaway tell him to start assisting smoking. He advises to quit smoking. Then the doctor assesses willingness to quit, whether the patient is willing to quit, how strong is his belief to quitting, how strongly he feels that quitting will help his health and all those things. And then thereafter, doctor's role is to assist in help to quitting, like assist in a way like you give him different options, the pharmaceutical options and other options how to he can go about quitting, and then last is arrange for the all these options which are available to him and arrange for his follow. Now quitting one may start in a lot of josh. Okay, we'll take a 31st or 1st January as a day to
Right.
stop quitting. Maybe first few days are very good and you feel very good. But thereafter the craving comes in and other peer pressure and other things come in and you start smoking again. So that follow-up is very important to understand how does it how you stop smoking. The follow-up is very important for individual to stop smoking.
Right. So, sir, once a person is in the process of quitting, they've started the process, how long does it actually take for our lungs to get healed?
You see, the benefits of smoking may come as early as 2 weeks, possibly. 3, 4 weeks, you start feeling much better. But as for the lung functions are concerned, as a COPD patient, other things, and they may take about 4 to 6 weeks to start getting. But the full benefits of smoking, quitting smoking, may start coming as late as maybe a year when you may come back to normal. But whenever you start quit smoking, is always a good day and good time to quitting, and it always helps. But approximately we take about that's about 2 months is a time when you start getting good benefits of leaving the smoking.
So, since, as I was listening to you, a question popped up in my mind. We've heard many people say that, we took the tobacco and we just put it on our lips. We just put it inside our mouth. We didn't actually consume it. We didn't put it inside our body. So, it did not affect
Yeah.
us. How true is that? Does it really affect us, even if it's still just in our mouth?
You see, tobacco when it goes in the mouth, the nicotine is always released and is absorbed. So nicotine is there going into your blood. So the side effects will be there. I mean, like what we are talking about is of tobacco chewing. The tobacco chewers have a lot of side effects, like the oral cancer. One of the commonest cancer in India is oral cancer, and is because of tobacco chewing, with the gutka and tobacco, all those people who use. So the same effect. The nicotine is going into there, and craving is always there. So addiction to tobacco chewing is as bad as smoking is there.
Right, absolutely. So, without taking much of your time, I'll just, go on to my last question. We've heard about this 2 month detox, to get rid of this addiction. So, how effective actually is this 2 month detox thing?
Yeah, as I already said, as you ask how long it takes to get rid of it, 2 months, there are so many different regimes that people are following: 1 month, 2 months, 3 weeks, 4 weeks. So 2 months is taken. One of the regime which are following is two months detox. Is they believe that first 3, 4 weeks you start getting benefits. After 1 month, you start getting craving again to start smoking. And if you stop it for 2 months, possibly the craving may not come back again, and the body may accept to live without nicotine. as what we say. So, but as I said again, first few months is easy, 2 months may be good and assisted, but what remains to be seen is thereafter. Unless there's a good willingness and strong will to leave smoking,
Right.
it always becomes difficult. But as I said, is whenever you can leave and wherever you can leave is always good. And 2 months detox has been shown to have good results, and people have done well.
Right. Thank you so much, sir. You have really shared some golden insights with us regarding how to get rid of this addiction and how badly this tobacco can actually affect our health. Thank you so much for taking out your precious time. And that is all for now. And with this message that we need to stop the consumption of tobacco to save more and more of precious lives. With this message, we end this video. For more such information, keep watching India TV.
Thank you.
Thank you
very
so much, sir. Thank you.